Hi, I'm Dr. Bill Johnson of Innovations Medical, and we want to talk some about the results of stem cells for arthritis. That's the most common question we get when we're asked about stem cells for any purpose, but especially for arthritis. Do they work? So we're going to talk about what the results are in published studies that can be accessed on the web through the National Institute of Health at any time. So the first question is, do stem cells work for arthritis pain? And the answer is yes. There are many studies now that show that arthritis pain, whether it's the shoulder, the knee, even the thumb, is very definitely relieved by stem cell procedures. These are not completely standardized. We still need to learn more about the best way to do it, but there's very little question anymore that stem cells help for osteoarthritis in many joints. Another question we're frequently asked is, will it help it function? Will it help how my shoulder, my hip, my thumb works? And again, the answer to this question is yes. All these studies show that joint mobility and joint functions are improved using standardized measures. So there's very little doubt that stem cells help with the way a joint works when we have osteoarthritis. One of the very common questions we get is, can stem cells grow new cartilage? And the answer is yes. This has been shown in hip, knee, shoulder, and other joints. So there's very little doubt that many patients can regrow cartilage, and there's other evidence, even a larger number of patients show less wear and tear over time if they maintain the same amount of cartilage, the same amount of bone spurring, where we would have anticipated them getting more. And patients in control groups get more spurring, more loss of cartilage compared to those that have stem cell injections. So definitely stem cells help with cartilage. Can stem cells work when the joint is bone on bone? And the answer again here is yes. Bone on bone responds very well, and in fact, one or two studies suggest that the more damage present, more bone spurring, the lesser amount of cartilage, the greater the results end of the day. So there's no doubt that bone on bone is not something to avoid, and there's some question as to whether those patients have some of the very best results. An important question we're asked is, do stem cells slow the progression of my joint disease? And while there's some questions about this, it does appear that many patients see an improvement in cartilage and a loss of bone spurring, or a maintenance of the amount of cartilage and bone spurring they have over time. So both of those would be referred to as a slowing of the progression. So it does not appear to happen in everyone, but many of us are unable to improve or at least maintain our joints. Now, some of the studies suggest that may do better with the second or even a third treatment. So over the next few months to year, we're going to be looking at, should we be doing more than one treatment in order to maintain or improve the joint rather than just give good results from a pain standpoint. Another question we get asked frequently is, how long will the stem cells work? We're a little limited on anything beyond 5 years because there aren't any studies that go beyond that. But up to 5 years, it does appear that we continue to see benefit. Again, there's some question as whether there should be a second treatment in the first year in order to improve the cartilage growth and maintenance of the joint. But the few studies are out there that are looking at how long suggest it's at least a 5-year period. We ask a lot what the best source of stem cells are for arthritis. There are studies looking at bone marrow, there are studies looking at umbilical, and there are studies looking at fat. There are one or two studies that suggest fat may be a little bit better than the others, but all of them appear to work. Fat is easier to harvest than the others, and there's at least one study that suggests that fat may be more consistently effective than bone marrow or umbilical cells. The final question we're going to ask is, can stem cells from fat for arthritis have other benefits? And the answer is yes. The stem cells have been shown to have a general body anti-inflammatory effect that lasts for several months and can give a lot of other benefits for patients. So if you have arthritis, it's worth looking into stem cells. They can definitely make a difference not only in your pain and function, but also in what you can expect going forward. Hope you've enjoyed this video.